So welcome to the first clinical experimental allergy podcast, and today we're featuring an exciting publication in the journal about the association between gender and health-related quality of life in people with food allergy and their carers. And this is a systematic review undertaken by Sophie Rosser and team from the Murdoch Children's Research Institute in Melbourne in Australia. And thank you, Sophie, for joining us. I'd just like to start by asking you to introduce yourself. Tell us a little bit about yourself and what inspired you to undertake this research.
Yeah, thank you, Bob, and thank you for having me on the podcast. So I'm a first-year PhD student with the allergy immunology team at MCRI in Melbourne, Australia. And prior to my PhD, my background was in epidemiology. So there's certainly a little bit of that lens, the epidemiology lens in this work. What inspired us to undertake this particular piece of research was this understanding that now that the greatest impact of food allergy for a lot of patients and their families is a reduced health-related quality of life. And there's been a lot of consumer advocacy in this space for a better recognition of quality of life in food allergy care. We also saw that in the existing literature that is on quality of life, that there's quite a limited exploration of patient-level factors, especially demographic factors such as gender that might be perhaps a bit more differently defined in a modern sense than they were historically. So we just thought this would be a gap that could be quite meaningful and have quite a benefit for patients and their families if we were able to uncover some more findings there.
Thank you. Yeah, so tell us what were your main findings?
Yeah, so we have a few key findings in this piece. The first is that females with food allergy and mothers of children with food allergy tend to experience quite poorer self-reported quality of life at baseline than their counterparts. Though notably in mothers, this was usually in quality of life subdomains, such as those related to the emotional impact of allergy or the psychological well-being associated with food allergy responsibilities. We also observed some weak evidence that males may have a greater quality of life improvement during immunotherapy treatment, though there are still some gaps in relation to that finding and more research is needed there. And we also thought it would be important to mention that in our systematic review, we didn't find any evidence that the proxy reported quality of life of children was affected by caregiver gender. So hopefully that's quite a relief to lots of study designers who rely on proxy reporting to measure child quality of life.
Yeah, very important. Thank you. And were these differences in females, were they food allergy specific quality of life, or were they more were people using more generic health-related quality of life instruments?
Yeah, this is a really important question because our review was open to including both studies that had used those food allergy specific tools and general quality of life tools. But we did largely find it was related to food allergy specific quality of life. And even in studies that use those general quality of life tools, they had restricted their sampling frames to food allergy populations. So we were most likely capturing the impacts of food allergy when using those tools as well. There were also a few cases in children with food allergy where studies had used both the food allergy specific and the general quality of life tools. And there was quite a lot of alignment in the results of both of those.
Very interesting. Very interesting. Thank you. So, so there's quite a specific gender difference in food allergy quality of life impact. Why do you think that is? Why do you think that females are more vulnerable in some ways to the quality of life impact of food allergy as carers or individuals with food allergy?
Yeah, I absolutely love this question. And really, I do think this is probably the next research question that comes out of this systematic review. Because for the moment, we can really only speculate on why those differences might arise. And it could be a bit of a combination of both biological and psychosocial drivers of quality of life, especially given the way in which we captured gender in this systematic review. We've looked at both, we've only been able to look at the gender binary where perhaps there is some overlap with biological factors. When we look at caregivers, I do think we could speculate that some of the differences seen between mothers and fathers there might be due to gender roles in parenting. We still see that mothers are often more responsible for the parts of caregiving that could be influenced by a food allergy, things like meal preparation or food shopping, organising social activities, interacting with schools, things like that. So then there perhaps is a bit of an accumulation of the food allergy burden in mothers as compared to fathers. But when we look at the patients with food allergy themselves, it perhaps gets a bit more complex. There are, of course, some potential for those biological factors to be at play, and that really might help explain the quite stark gender difference we observed in adults. So, as we move into adolescence and adulthood, we do see that shift of food allergy prevalence and severity of allergic conditions where females are now more affected, but in childhood the opposite is seen, and males tend to have a higher prevalence and severity of food allergy. So that could be leading to some of it. But again, there's also that possibility for there to be psychosocial drivers, including things like social or behavioural factors, or even some influence of other conditions that might correlate quite highly with food allergy and have that female predominance, like eating disorders.
Fascinating. Thank you so much, Sophie. It's been really interesting to explore your findings, and thank you very much for joining us.
Thank you.